It's no longer something that a rare few patients want to talk about. I think this is what the majority of patients want, to be introduced to them very early on in their journey. And so this is something that we all have to become comfortable talking about. You don't by any means have to be an expert in this field, but having those open conversations with patients will go a really long way. And for providers to also know what are reputable sources that they can give their patients if they're seeking out integrative care, because if they don't, they're going to find it elsewhere. There's still an idea that integrative and alternative are the same. And I oftentimes will start off a patient visit with explaining the difference between those two words, right? And so saying how we are truly trying to practice in an integrative way and having the best of both worlds be combined, using standard of care treatment and using integrative modalities to help treat symptoms and side effects and maybe even improve the effects of the standard of care treatment, rather than saying, here's an alternative for the treatment itself. And so I think when people do hear integrative medicine, a lot of times they assume that means that their patient is not willing to do or use conventional treatments, and that might not be what they're asking. Maybe they're asking for just the use of these safe integrative approaches as well as their standard of care treatment.